Professor Kiparissidis for the introduction, and thanks to the organizing committee for inviting me. Before I start with my presentation, let's have a very, very short look about nano emulsions. Approximately 40% of new chemical entities have a poor solubility. Further disadvantages of new chemical entities are a high partition coefficient and high molecular weight. All these factors are leading in general to a low bioavailability and decreased permeation. Now, how that problem can be solved? Nanoemulsion can be a way. It can be a way like we will show. Let's have a look about general advantages of nanoemulsions. They could have an enhanced drug solubility and drug stability, an enhanced dissolution, a low biotoxicity, of course the avoidance of organic solvents, and an easy scale-up. General routes of application for nanoemulsions are the dermal or transdermal way, the parenteral, ocular, and the oral route. During my PhD, I worked with the dermal and ocular way, so for me, I have to make a decision about the rest. These are only examples. These are the most popular ones. Because the secret of my formulations is the positively charged. And like we've heard today, applicating positively charged formulations to the bloodstream is problematic. So the parenteral way was disqualified. And I looked at the oral application, and I found until 2013 only these few examples. But there are more examples, so-called nanoemulsions. I looked more precise at these studies, and they are not really nanoemulsions. They are microemulsions or self-nano-emulsified drug delivery systems. But to the very precise definition, they are not nanoemulsions. Sometimes they are called submicroemulsions. This is acceptable, but microemulsions are not nanoemulsions, and self-nano-emulsified drug delivery systems too. So that was the driving force. Only these 5 drugs, it was too less. So we have started a new study. The aim was to increase the intestinal absorption of the drug pitavastatin by using nanoemulsions. Why pitavastatin? Because it's one of the new generation of the cholesterol inhibitors. It has a poor solubility, leading to a low permeation. And we wanted to investigate the effects of the positive charge of our emulsion. These nanoemulsions were prepared by the microfluidization technique and characterized according to their droplet size distribution, setup potential, and permeability. Finally, the in vitro cytotoxicity was checked using KCO2 cells. Looking at the preparation reveals, and our formerly experiences have shown, that there are 2 important groups for preparing nanoemulsions. These are the formulation parameters and production parameters. For the formulation parameters, the type and concentration of crucial constituents is very important. So we checked the oil, emulsifiers, and our miracle substance phytosphingosine, abbreviation as PS. For the production parameters, we checked different temperatures, pressures, and durations. Our experiences have shown that production parameters are more effective for producing stable nanoemulsions than formulation parameters. That's the reason why we have checked here more production parameters than formulation parameters. Looking at our compounds we have used, of course, we have 2 different phases, the oil phase and the water phase. We have our drug. This is pitavastatin, poor soluble. We used the oil, oleic acid. We have tested 2 different substances, oleic acid and a substance called euethanol G. It is chemically nothing else than 2-octyl-dodecanol. But after dissolving pitavastatin, and let's say for 24 hours, pitavastatin precipitated in euethanol G, so we decided to use oleic acid. Our substance phytosphingosine was responsible for the positive charge. Lipode ET is an egg lecithin, is well known from the literature and from our studies about stabilizing effects for emulsions. And we used the antioxidant alpha-tocopherol. The water phase was built more easier, not so complicated. We use as the emulsifier 380 as a preservative potassium sorbate. The only difference between the formulations F1 and F2 is the substance phytosphingosine. How these nanoemulsions were prepared. The water phase and the oil phase were prepared separately. After adding the water phase to the oil phase, we used a high shear mixer at 8000 RPM for 3 minutes, so we get a coarse emulsion. This was transferred into the microfluidizer and produced at the predetermined production parameters to obtain our finally nanoemulsion. This is a picture of the chamber inside the microfluidizer. There are so many types, so many models. We use this one. There are two general types of this chamber, a Y type and a Z type. If you imagine half of this, it looks like a Y, and another type is that Z type. The Y type chamber is generally used for softer carrier like nanoemulsions, and the Z type is generally used for harder systems like nanosuspensions. According to characterization, we checked the physicochemical stability, the permeability using KK2 cells, and cytotoxicity using again KK2 cells. When we started to produce at predetermined production parameters, first we checked the pressure of 300 bar, and we had a bad surprise. After 1 day, there was a phase separation of the emulsions. So 300 bar was not enough. We got to increase the pressure to 500 bar. Next, we produced at the same durations of 1 to 5 minutes at room temperature of 25 degrees. And the next shock we have observed after the analysis of the drug per HPLC, even at the day of the production, when the nanoemulsion were produced at room temperature, there was a high degree of degradation, about 60%. So we got only 40% of that pitavastatin. So we decided that was reasoned by evolved temperatures inside the microfluidizer during the production. So we decided to decrease the temperature to 15 degrees Celsius and go on with the rest of the parameters. We checked the droplet size distribution, zeta potential, and the drug content. Here are the results of the two different formulations according to the mean droplet size, polydispersity index, which reflects the size distribution, the LD size, and the zeta potential. Here it has to be mentioned that results according to particle size, where only the average particle size are given, is not really correct, because this is an average particle size. You have to check again the LD size. LD size means these are LD99 values. LD99 means that 99% of the measured samples are below the given value. That's very important, because, an example, you can have an average size of 300 nanometers. This can be a mixture of 100 nanometers and 500 nanometers. So to check this, the polydispersity index is very important. So we checked for 1 to 5 minutes, and it was observed that at least 4 minutes are needed to get particle size, or nanoemulsions with a particle size below 200 nanometers, and with a narrow size distribution of approximately 1.15. Again, the zeta potential is for the stability of emulsions very important. A general rule says that you should, independent from the prefix, positive or negative, a value above 30 millivolt. Independent from the prefix, because we have here both positively and negatively. Here could be seen that with increasing the duration, the LD size decreased, and the zeta potential just after 2 minutes is high enough. It's about approximately minus 45 millivolt. So taking all these factors together, 4 minutes were at least needed to produce suitable nanoemulsions which were charged negatively. For the nanoemulsion with phytosphingosine, there was particles obtained which are a little bit bigger because phytosphingosine was incorporated. We have particles of approximately 300 nanometers with a polydispersity index of 0.3. the LD size was acceptable, and more important, we needed at least 3 minutes to get a setup potential of above 30 millivolt. So the next step was checking the permeability studies by using Keiko2 cells to check if there is an enhanced permeation or not. The results for F2 with phytosphingosine reveals that the lowest efflux ratio is here obtained, which means F2 with phytosphingosine has the highest permeation of the here tested formulations. The next step was checking the TR value, transepithelial electrical resistance, and here we have heard today in the sections about A to B. B to A means from apical to basolateral and from basolateral to apical side. Once again, F2 had the highest values. It could be proven that our formulation with phytosphingosine, which is positively charged, have the highest permeation rates. Finally, the cytotoxicity was checked. It could be shown that the viability of the cells is about approximately 100% for all formulations, even the pitavastatin solutions. Concluding, in nano emulsion containing the poorly soluble drug was prepared by microfluidization. The formulation with phytosphingosine showed the highest permeation using Keiko2 cells. Both nano emulsions and even the solution were not cytotoxic. So we can summarize that an oral application of pitavastatin and phytosphingosine could be applied with an enhanced intestinal permeation. Thanks for your attention, and to my colleagues, Dr. Köksal, who was responsible for the cytotox studies, Assistant Professor Gündoğdu, who was responsible for the HPLC analysis and the permeation tests, with nice greetings from the sunny Izmir and from my faculty. Thank you very much.
Thank you very much for keeping the time.
You're welcome.
We have more time for questions now. The floor is open. Go ahead.
Connected to the micro. Maybe I can repeat.
Okay. This compound that gives the positive charge is evident, has very low toxicity. My question is related if you compare this compound with the usual surfactant, the cationic surfactant.
Yes, I've checked this during my PhD for the dermal application with sterile amine, for example, and it had serious advantages. I worked with sterile amine. It was really cytotoxic for my studies, dermal, so I decided not to use it. And after looking for other substances who gave a positive charge, we have found this one. So we had the opportunity to work with chitosan, but it's so well known. It has some advantages, some disadvantages. For us, for our studies, this is a very hot substance, and from my PhD on, it's used more often in the literature. If someone wants to work with it, I should have some milligram of it.
And did you test increasing concentration, or
yes,
it's related to the low concentration?
We have a publication. Is it just right? Yes, I have to look. We have checked it. We have another publication where we worked with microemulsions and pitavastatin, and we have used it there too.
Thank you.
Any other questions? Yeah, one question. Let me ask you one final question. What is the long-term stability of this nanoemulsion? Because have you left it for some weeks? And
yes, we checked it for 3 months.
Yes.
The nanoemulsion without phytosphingosine was, of course, more stable, but the emulsion with phytosphingosine was acceptable too. There was not a significant change.
Not significant change. Very good.
It has to be checked, of course.
Always.
Without stability
Always.
studies, these studies make no sense.
Always. that you live a good life.